Mind map, a clear path to mental health. Psychosis is surprisingly common, more common in fact than multiple sclerosis and muscular dystrophy combined. It affects 1 to 3 out of every 100 people at some point in their lifetime. And for every person who has psychosis, there are many more around them who are also affected. Psychosis is a young person's disease. Most mental illnesses are. Symptoms of psychosis typically appear in late teens and early 20s, and the overwhelming majority of people who will develop psychosis get it by the time they're 35. Early detection saves minds. The sooner somebody with psychosis gets the treatment they need, the better off they'll be and the faster they'll get back on track. Compared to no treatment and treatment as usual, early treatment is much more effective. So what is psychosis? It's a brain-based disorder that causes someone to have difficulty perceiving the world around them accurately and affects thinking, behavior, and emotions. Symptoms include hallucinations, delusions, confused thinking, and lack of insight. So what are hallucinations? They're false perceptions in any of the senses: sight, sound, smell, taste, and touch. A person with psychosis may see things that aren't actually there, like colors, shapes, people, or animals. They may hear noises they can't quite make out, or voices that are mean and critical. They may smell stinky odors and taste unpleasant tastes in their mouth, feel as if someone is touching them, or that there are bugs crawling on their skin. We all have wrong ideas sometimes, but a delusion is a belief a person continues to hold on to, even when there's evidence it isn't true and when it seems impossible or bizarre to other people. Delusions can be grandiose, thinking you have special powers or abilities or are an important religious figure or person, or paranoid, thinking that someone else or an organization is out to harm you or get you, which can lead to unusual behavior. People with psychosis often experience confused thinking. Their thoughts may be all jumbled up, leading to them being difficult to follow when they speak. They may jump from topic to topic, stop in the middle of a sentence, or appear to derail their train of thought. Early on, a person with psychosis may be frightened by their experiences, but as time goes on, they may start to believe that symptoms like delusions or hallucinations are real, and not recognize them as strange. It's also important to know what psychosis is not. Stigma and misunderstanding can keep people from seeking treatment. Split personality or multiple personality disorder are not psychosis, and it's not simply a matter of weak character. A person can't just choose not to have their distressing symptoms. Dangerousness is often a stereotyped idea about psychosis, but people with psychosis are no more likely to be violent than the average person, except under the same conditions anyone else is, like when they're abusing drugs or alcohol. The term psycho is often confused for psychosis, but really this term refers to psychopathy or a severe antisocial personality. Psychosis is just like any other medical condition. The person suffering from it didn't do anything to cause their disease, and they need treatment just like they would for any other illness or injury. Whether it's due to stigma or lack of understanding, too many young people and those around them ignore the symptoms of psychosis and avoid getting the treatment they need. Myths can be part of the problem. One myth is that treatment doesn't work. But in fact, there is a lot of research that early intervention is effective, and the sooner that treatment starts, the more likely the person is to recover. People may fear that treatment is scary and painful, but do you believe everything you see in the movies? Treatment is safe and comfortable. People may fear being locked away somewhere, but early treatment often happens in an office-based setting. The person comes in for an appointment and then goes home after. Early intervention is effective, and it's available in your community. It doesn't cost anything, and it's completely confidential. Mindmap's mission is to work with our entire community so that no matter who a young person with psychosis comes into contact with, whether that be somebody at school, a member of the clergy, a police officer, a mental health professional, or a primary care provider, that person recognizes the signs and gets the person quickly to the right treatment. Treatment may involve medication if necessary, psychotherapy and counseling, education and support for the person with psychosis and their family, and assistance with work and school goals, things that are important to our patients. Now that you know what to look for, if you're concerned about yourself or somebody else, You can take a brief quiz on our website, or you can call us. You don't have to give us your name, and calls are completely confidential. Thank you for learning about MindMap and being part of our clear path to mental health.